Let's go over the social 6 concept. Our goal is to focus just on anterior aesthetics, which is the small zone. For this social 6 area, we're focusing on canine to canine, top and bottom, mild crowding and rotations, and then relapse cases. No bite correction, purely cosmetic alignment, and this is ideal for the GP workflow. Profitability and growth. Social 6 basically means fewer trays, faster cases. So the lower lab fee, higher perceived value. When you bundle this with whitening veneers is absolutely amazing. 1 or 2 cases per month as a meaningful profit. What's great about this is the scalable practice growth. Let's go over the social 6 in detail. Targeted high impact aesthetic areas. Not comprehensive ortho. The magic is in keeping the treatment clean, efficient, and highly predictable. I use the simple framework for case selection. Simple framework consists of the social 6 focus, mainly front teeth, identifying relapses or areas of aesthetic concern, managing these expectations early, predictable movement only, limited mechanics, there's no expansion, class correction, extrusion, or intrusion, and then easy short treatment time. For case identification, I like to go over a couple things that we look for. These are the dividing lines between suitable and unsuitable cases for social 6 cases. So let's go over case identification. Some of the suitable cases are mild to moderate anterior crowding, post-ortho relapse, stable posterior occlusion, or mild spacing. Unsuitable cases are expansion, extrusion, intrusion, or class correction cases.